Okay, so for the compression has two main goals. First is to reduce the swelling and improve the energy and the way the patient they feel, and by reducing the swelling, the patient is going to feel much lighter, is going to have less discomfort. That's one of the goals. And the second goal is to help with the recovery of the skin. So we usually require the patients to wear the compression usually from 3 to 6 months after surgery, and they're going to remove the compression gradually because they have been used to the compression for quite a lot of time. So we ask them to remove them like progressively, maybe some hours one day yes, one day no. So it has to be like very progressive.
Some people ask if they don't find the flat knits, could they only wear circular knits as a conservative treatment?
Not in relation to surgery, you mean?
Not even.
All right. So the circular knitted garments, the problem is that first, usually they are not like made to measure, and second, they tend to hurt a little bit behind the knee and in the ankles. So of course it's better than nothing, but sometimes some patients they find it more uncomfortable than comfortable. So I recommend these patients to try to go to a place that they can get the flat knitted ones, because the difference in relief it's very, very deep.
Okay, and if they can't at the moment do surgery, will the conservative methods such as wearing compression or eating an anti-inflammatory diet be enough to reduce the size and change the shape?
The effect of conservative treatment is intermediate, and also depends a lot on each of the patients. Some patients they find a lot of relief, and that they find that they feel much better, much lighter, and they can reduce some volume, specifically in the thighs. Lower legs sometimes they don't change that much, whereas some other patients they don't see much change at all. Also, we need to think about the conservative treatment as something that has to be maintained. So depending on the place where the patient lives, sometimes it's not realistic to ask them to wear compression for life. If for example, they live in a very warm country with like South America, Middle East, in south of Spain, for example, they wear it for 1-2 years, but then they get very tired of keep wearing them. So conservatism is very helpful, and specifically the anti-inflammatory nutrition is helpful for everybody, but the compression, to wear this tight compression for life, is not that easy, and sometimes it gives the patient a hopelessness. So we know that with the surgery they're going to need it for 3 to 6 months, which is going to be quite a difference compared to wearing them for life.